I'm not sure if you're aware, all our minds, human minds, have got limitation. And that limitation is, you cannot imagine what cannot be achieved. Do you get that? If you can imagine it, you can achieve it. Everything what we saw as futuristic movies, the Star Treks to the Terminators, to everything we have seen, each one of them today are becoming a reality. And that pulls you back to say, the Ramayana and Mahabharata's imagination of able to see remotely, do things remotely, fly from one point to another, all this which has been imagined by human mind is possible. Please believe in that. And that's what has been the experience of our generation. Nobody has seen the changes our generation has seen in the last few years. As you can see, the picture you see on the left-hand side is what we study in anatomy. The vein looks blue, the nerve looks yellow, and the artery looks red. But when you really get into surgery, that's what you see. A whole lot of tissue which is of the same color. And we all know the number of surgical mistakes, the iatrogenic pathologies, the iatrogenic problems which have happened in US where there's more data collection is mind-boggling. Let's see what has been possible. Today, and this is about 4 years ago, I knew there was research going on this. This is called the fluorescent technology. When you look at fluorescent technology, you inject stuff into the body, it uncouples at the right place. When it uncouples, the tissues will be seen like this. Just imagine this. If it can color itself up, and if it can be seen like this, and you resect the tumor exactly where it has to be. You don't cut open all the tissues around to cover all the, you want to get into the normal tissue and be safe about the tissue which you have taken out, nor you underdo it, you precisely do what has to be done. And this is in practice today. We do this in our hospital today. Fluorescent technology is possible today. Look at this. If this was possible, if the sciatic nerve says, here I am, how many of us would ever cut it? And if it can be labeled, the tissue labeling is possible today so that we make less mistakes on our fellow human beings and cause the extreme amount of grief. Look at this. We used to do endoscopies. Today we have tablet endoscopies. We have endoscopies which carry a microscope at their end, and you can pretty much see microscopic tissue details of the tissues inside. And your diagnostic and where you take the biopsy from, so much more accurate than ever before. And that's how it can be studied. So today, if there is a gastroenterologist, he also needs to be a pathologist to be able to differentiate tissues. This is something completely exciting for us as orthopedic surgeons. When you have an amputation, how many of us have seen an upper limb prosthesis being used? Most of the time we give it, but it gets discarded. Targeted reinnervation is a wonderful science which has developed. What it does, we know that ultimately the message has to go to the brain. And end of the day, wherever the amputation is, the nerve endings have got the different part of that organ, that different part of that limb available for reinnervation. And what's been possible today? Look at this lady who has been fitted with this arm, and what happens the first time when she's fitted and she feels the sensation?
I want you to watch closely.
Ooh. For the first time, she feels the sensation in an artificial limb. And that's what we want. Can you imagine this is possible? And I'm not saying this is over 50 patients worldwide have been using this. And look at what is possible, how smartly this person can use the arm, because there is sensation at the end of that limb. And that's how the science is developing. That's how we are progressing. This is all reality, not a fiction anymore. This is a lady I met in San Diego. The MRI scan, which is this huge gantry and so expensive, is reduced to as small as a helmet and can give you equal amount of details. The total new approach to the technology of scanning the brain. And they use ultrasonic waves to get as much details of the brain as it's possible. It's an open water technology. Look where we are going. This is amazing. When you want to do an EEG for a child, you shave the head, sedate, child is crying. Today that's not required at all. You just put this gadget as a helmet on the patient's head, and the EEG is done. It goes to the cloud, and the report is back. The neurologist is too busy to report for 2 days. This happens in minutes, and this is possible today. This is real. The telepathy. The machine connected to your brain can appreciate your thoughts, and it can transmit to the other person who's wearing the same machine, and the other person knows what you're thinking. That has undergone phenomenal amount of research. So be careful what you think, right? So non-invasive breath analyzer, the diagnostic medical science is exploding with possibilities. Today, you just have to do a breath analysis to find out up to the cancer. That is how much of diagnostic is possible today. Take control over your own health. Saliva. We don't need to do blood tests. Just take a swab of the saliva, and there are hundreds of reports generated within no time. And that is the kind of advancement we are looking at. I won't explain too much about this. Even the sex toys have got very gadgetry, and there are huge amount of science is being used in all this stuff. Yet another field. This, for me, is cutting edge. There are 256 scientists working in New Jersey on tissue regeneration. Can you imagine if this is possible, all of us would be not doing what we are doing today? This is a salamander. This is a real-time picture. For 240 days, a Sony camera focused on that, and that's been compressed into this picture. See what is this doing? This animal can regenerate its entire limb the way it was. If this tissue regeneration science can be taken to the next level, you can imagine what is possible, and in its fullest form. And this has been work in progress for so many years now. You won't be surprised if this becomes a reality. Even more exciting. There's a chap called Srinivas who's been working for 22 years at MIT, a Bangalore man working there, trying to digitalize touch. Today, voice is digitalized, picture is digitalized. There's only two things which are not digitalized today. That is touch and smell. Smell can be digitalized. You have great cooking classes at home on the television screen. If touch can be digitalized, end of the day, when you touch, it's the temperature, it is the texture, it is the feel. If all those things can be broken down and digitalized, it will be the most amazing thing. Vikram Shah has been talking about, unless you appreciate the tissue tension, you will never be able to achieve the ultimate answer with the robot. And if this can be digitalized, Narendra is going to be so much closer to making a robot do much more than what it does today. Don't let your imagination go wild about digitalizing touch. So that is possible today. Look at the Disney world, look at the movie world. What can happen with this possibility? I was shocked to see this. Today, the American neurosurgeons are working. It's still work in progress. They have experimented it on 12 people so far, a dozen people. They are able to substitute our 5 basic senses. Let's say we have loss of hearing. You're not able to hear. So if I don't hear, then how do I respond? What do I do? And firstly, the learning of the brain synapses with different parts of the brain does not stop as a child, which was what was thought at one time. I know your dad is learning music now, and that's because the synapses are still developing. So that has been established. Learning can go on and on and on. It just requires a habit of learning. Somebody has lost a hearing, they put a pad on the chest. This is a highly sensitive pad on the chest. And if Narendra is talking to me, I'm deaf, this pad vibrates in such a way that I develop that perception and I learn to understand what you're talking, and I can respond to you in real time. They have really tried, and I have seen this as a demonstration where this pad is so sensitive, it can pick up what you're talking and you respond. You're taking away the disability of not able to hear. Imagine what a fantastic progress that is in science. wonderful things. At Bangalore, we tried remote surgery. With 5G coming in, we could operate from New Zealand in a cadaveric lab at Bangalore. So that is possible today. So distance is not a factor anymore. If somebody can remotely operate, that is possible today. Put all these things together and see what can happen. It's an explosion of possibilities. There's never been more exciting times in life. If you look at this slide, the Spotify founder is investing big time in healthcare. The Apple is investing big time in healthcare. You know, wherever there is sugar, there are ants. These are business houses. If all the business houses are looking at healthcare as a very big thing to happen, we are sitting ducks. I'm telling you, before the technology companies take over us, we should be stepping into technology and trying to be advancing ourselves, and we should own technology rather than being taken over by technology companies. For me, this is a philosophical question. I've always battled with this. Existing medical science should reach all the people, or exceptional medical science is okay to reach a few people. What would you think? I'm telling you, what you're able to do in Pune today, 100 kilometers down the line, they don't get the medical care what you do to here. They don't have the expertise 100 kilometers away from the cities of Bangalore or cities anywhere in India. They will not get, they cannot do a hemi-orthoplasty as good as it can be done in a good setup. We are not even able to achieve that. It is 100 years or at least 60 years since the joint replacement has been done successfully, but how many people are able to get it? Doesn't it affect you? Just zoom out of the situation for a minute. Don't think you're orthoplasty surgeons. Don't think you're doctors at all. Look at the society, look at the world. Does it get the medical science everybody really, really deserves? In fact, a poor man needs better medical science than a rich man, because rich man has enough people to help. But if a poor man gets into trouble with his health, then livelihood is gone. And that's how important it is. And this battle is not one. Ideally, we want both, right? Let us see if it is possible to achieve both. For the first time in the history of the world, I strongly believe it is possible to achieve both. For that, what has to happen is this. It has to be more affordable, more accessible from every remote part of the world. We can't even achieve that in a remote part of India. Forget about the world. The world is a much bigger place. Can we give the same quality what we give it to everybody else? Patient-led innovation and management. How much do we listen to the people, what they really want? We keep thrusting down the throat what we think is good for them, but what they really want. Sometimes the solutions are worse than the problem itself. So we have to address this issue. Two things in my view are the most important ones to achieve what I'm talking about. One is scale, second one is precision. Sometimes the science is not precise enough and we do more damage. Can it be more precise? Can it do at the scale? Let's talk about that. Today, the world is talking about predictive, preventive, personalized, and participative medical science. When I say this, I'll tell you a very interesting story. I met an Israeli gentleman who's a great scientist. And Israel is a small population, and every citizen of Israel's data, including genomics, every time he sneezes, it's all captured and kept in their country. So this gentleman told me how much of mapping has been done. He said, I'm standing on the stage, suddenly an ambulance stops outside and the paramedical staff runs and stands next to me. I said, why are you here? He says, in the next 20 minutes, you're likely to get a heart attack. I said, how do you know that? This is predictive science. We have been tracking your health. If your sugar levels are this, your weight is this, your smoking habits are this, the data says you're likely to have a heart attack on 27th of May at this particular time. So I will warn you 5 years before that if you don't change your habits now, your Of course, it's an exaggeration, but that's how predictive science and preventive science is happening. It's personalized because every medication we give is 500 milligrams 4 times a day or whatever, antibiotics for so many days. Today, it's not done like that. Your genomics, how much drug is sufficient for you, why bombard with amazing amount of antibiotics or whatever medicine we give to the side effects are much worse than the disease itself. It's not necessary. Your genes, your type may not require that much of dose. So it's personalized. The medication is personalized. It's participative because the patient should be able to access and choose what he wants. These are the buzzwords of today. The democratizing healthcare, the way patient experience healthcare, how he registers with you, comes to you, pays you, has a wallet which can take you to all the departments and does it, how he carries his discharge somebody remotely. All this has coming a long way. Accuracy of treatment, ability to diagnostic facilities, the precision of treatment has become the biggest thing. Lastly, we have been talking about robotic. This is a robotic meeting. Let me tell you, this robot, what you're seeing is not what it really is. I really believe if this robotic surgery all of you are participating and doing can achieve one thing, then it's really worth all the effort of learning and everything else. Let me come to that. When you do a robotic surgery, you are collecting all the data of the patient, so much of varus, so much of valgus, so much of bone, anatomy, osteophytes, billion things. All this is fed in one data point. I've been to the headquarters of where all this data is being collected without your permission. They're collecting all the data. And this data and then the outcomes of what you execute in the operation theater is also known. All the top surgeons of India sitting here, what they do for every given situation, that's what is being studied. It's not going to be long before there's an algorithm which says you have this and this and this parameters, this is exactly what you need to do. For me, that is brilliant. If that is possible, you can work with your fingers, don't need cerebrum, cerebellum, nothing is required because you've been told what to do. And that is possible with the data collection. The power of data is amazing. It's no more anecdotal medicine what our teachers taught. It's no more evidence-based medicine what we grew up. Today it's all about data science. We have to believe in what the data shows as long as authentic data is collected. And this is a wonderful authentic data which is fed and kept. This is what it will do. If you can do that algorithmic way of doing things, geographic barriers will go. Resource constraints will come down. Disparity in expertise will disappear. If you can produce 100 Vaidyas, imagine how good the environment in and around Maharashtra will be. Because I'm 100% positive each one of you are great surgeons, but you take so many years of experience to become what you are. For me, this is the future, cyborg. This is what it is. Already we have joints in the leg, we have got a pacemaker in the heart, we have an artificial this, artificial that, except for the artificial hair, which is not a big impact, but everything else today has been done like that. This is the future. Human and machine are going to gel together, and that's when the exponential possibilities will happen. I leave you with this. If experience can be digitalized, this is possible only with data and the science. If experience can be digitalized, then once it's digitalized, you can multiply it unendingly. If I can collect the experience of all of you and multiply unendingly, I can serve the world unbelievably. If I can operate remotely, and if I can operate on algorithms, what a wonderful world it is. If I am a patient, why should I be part of your learning curve? Will you accept when you're flying to Paris that there's a pilot who's a young, inexperienced pilot is flying? If I announce, will you accept it? I know the plane is going to land safely because this young surgeon is equipped with so much of gadgetry which will guide him to land safely. That's what I want. My daughter is graduating as an MS Orthopaedic student in the next 2 months. I want, when she does the surgery, I want it to be as good as Narendra Vaidya does surgery because she has got enough gadgets to guide her. And no patient will suffer because of that. You need to have technology for simulated learning, technology for digitalizing, algorithmizing everything else. Our egos are very inflated because we boast of the experience. When you're young, you're enthusiastic. When you're old, you want to say, I'm experienced and nobody can match it. Can we be a little larger than that and give our experience in a digital form and multiply it unendingly? Thank you so much for listening.